Hi, my name is Brooklyn Alumba. I'm a Tigerlily angel and also a 4-year breast cancer survivor, and I'm here at SABCS with my co-fellow.
My name is Kai Pollard. I am also a Tigerlily advocate, and I'm a 5-year breast cancer survivor, and I'm so thrilled to be here at the SABCS this year.
One of the things that we went to yesterday was the keynote address, and that was by William Kaelin with Dana-Farber. And wow, what an amazing talk.
It was really interesting, him talking about how people are nervous about the genomic heterogeneity in tumors and what that means for treatment. And, I loved his analogy about comparing these genetic mutations to a lock, a 3-tumbler lock. He said, how many numbers must be in place for the lock to open? And it's all 3. And how many numbers must be out of place for the lock not to open, and it only takes just 1. So, that was kind of discussing the disruption of just 1 mutation, that it might take 3 mutations to make that cancer grow, but disrupting 1 of them may stop that. So one of the things that he was discussing in his session was the importance of combination treatment, and how trials are sometimes designed where they will do treatment A, discontinue that, and treatment B. And he discussed the importance of maybe reconsidering trial designs to keep on treatment A and then slowly add on treatment B in addition. He discussed the importance of a combination of maybe 3 drugs to be optimal to treat cancer patients, to encourage the best survival, because all it takes is 1 cell out of, what did he say, 10 to the 9th cells in a small tumor to be resistant to a single agent that would lead to resistance, and the tumor will, regrow because that 1 single cell can survive. So yeah, understanding, pushing more towards combination treatment has me very optimistic, and especially in clinical trials. I mean, we do see it a lot, but I think moving away from single agents is really important because of those resistance mechanisms that can then lead to decreased survival. So,
One thing I thought was interesting, he came back to the expression and said, beware of naysayers. And I thought of that in a lot of different contexts. He really spoke about it in the sense of a lot of times we found these different things almost serendipitously. But being aware of naysayers who say, oh, well, that might not be an appropriate treatment plan. But maybe, like you said, if we treat it in combination therapy, maybe we might find a different outcome. And I think of that also in my advocacy, wearing of naysayers. People saying that patient advocates shouldn't be in the room. People saying that, this isn't your place. Maybe your place is better served over here. But really, we should be at the table in all conversations. And one thing I really appreciate about SABCS, they've invited us to the table. He even spoke in his keynote address, and he said, yes, we're talking a lot about the data, but at the end of the day, behind every number, there's a patient. And everybody, you can see the crowd saying, yeah, we agree. Our voices are the ones that are the recipients of these treatments. Our experiences matter. What we are looking for in research matters, because we're not going to join a clinical trial. It's not something that's relevant to what we're going through, right? So I really appreciate that he humbled and really had the crowd think about that, that behind every number, there's a patient. So I was just really impressed by that keynote. I thought there were so many great points, but that was one of my favorites.
I think one thing that this has really made me consider is the importance of advocacy for patients through their journey. We talk about combination therapies, but what about, they talk about cortisol, right? Being leading to decreased survival for patients, high levels of stress throughout their journey. And, what's the prescription for that, right? So these advocacy companies that help buy patients groceries, take care of their homes, that I think should be considered a part of a patient's treatment plan. It's really important what we bring to the patients, as well as these scientists and these doctors.
I think he was really giving everyone the notion that we should be thinking about patients comprehensively, not just about the treatment, but some of those other things that can also impact your treatment as well. Just being able to help somebody get food in their house, feed their children while they just focus on getting better. All of that is so important in the healing of the patient as a whole. And I think he really challenged a lot of the audience to think about that. So it's been such an exciting time. I hope you stay tuned and follow us for more updates from what we've been seeing at SABCS.